Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Delighted to be back with you on this. Okay, it's not raining, it's cloudy, but at least it's not raining Wednesday morning.
Yet.
We have another great program this morning. Today we're talking about COVID-19 and stroke because there is this association between those two diseases. And how do you prevent that? Get a vaccine. We're going to be talking with the director of our Comprehensive Stroke Center, neurologist Dr. Colleen Lechtenberg, and internal medicine physician Dr. Matt Jones. They're going to talk to us about 7 ways to avoid a stroke. And we're going to have a little bit of conversation about what all that means and the effect of COVID-19 on what we're seeing around cerebral vascular disease or strokes. But first, Hawkeye, how are we doing today?
We're doing good still.
Yeah.
So I think we're pleasantly surprised with the current numbers, both in cases in the U.S., locally, but also here hospitalized cases as well. We have 11 active infections, 2 in the ICU, but both of those are on the ventilator. Still have 7 in that recovery period, so a total of 18. And then Hayes has 2 active infections and 1 in that recovery period as well. So, they're keeping low. Certainly they've been lower. They've been at 0 or 1 cases, but overall, I think here at our hospital, we're doing pretty well.
And I think the one thing I'm really happy to see is when you look at the number of patients who are admitted who are symptomatic with COVID-19,
exactly right.
That's even lower than 11, right? Because some of those people who we have as positive are people who are, and got a screen for being symptomatic. So we're just so much better. And, you and I were texting a little bit this morning. The CDC and their, if you really want to read and be nerdy, the MMWR morning, the monthly morbidity and mortality weekly report. It's not monthly. Morbidity and mortality weekly report, MMWR, had a report last Friday looking at healthcare workers who are routinely exposed to COVID-19 patients and the effectiveness of the vaccines, both with a single dose of Moderna or Pfizer or the double dose regimen, 82 and 94%. That's really good.
Yeah, and I think we can apply it to the general public, and we really need to get those vaccines in arms is what that means. So.
Yeah, but just to say what that means, folks, is that there is an 82% chance with 1 shot of Moderna or Pfizer, or a 94% chance in 2 shots within a healthcare working population with folks like us, that your chance of acquiring symptomatic COVID or significantly symptomatic COVID is reduced by 82 and 94%, 1 shot, 2 shots. That's really great data, but it also confirms what we're seeing nationally. That's why the numbers are dropping, or part of the reason the numbers are dropping is why healthcare workers are staying healthy.
And I think a couple points to that. And so then that way we can hope that you would still be able to transmit the virus less, even with that single dose. But it is important still to get that second dose because we don't know the long term, the durability with just that single dose. And I think most experts believe that you're going to have at least a year of good immunity from that double dose vaccine. The other thing that has recently come out is still good immune response to those certain variants, particularly the UK variant, and of course that variant that was first identified in India as well. So a little bit reduced as far as the antibody titers goes and the neutralization, but still very effective in preventing that. And we know that variant first identified in India now is cropping up in more places. And there's also reports that maybe it's even more transmissible, so a little bit easier to get. So it's important, especially with these variants that are becoming more prevalent and any new variants that arise. Please, if you are in that category of 12 and above and you have children in that category of 12 and above, please go get your vaccine.
Yeah, and when in doubt, wear a mask.
Absolutely.
It still works.
Yeah.
All right, let's first see if there are any reporter questions out there this morning.
Good morning, Cody Holyoke from Channel 9.
Hey, Cody.
Hey, all right, so Dr. Stites, for months now, you've been saying you've been waiting for this moment where we can all go back to the K and watch the Royals. They just pulled that trigger yesterday for May 31st, opening up to full capacity. Is that too soon? What's your thought?
First of all, nice win last night. That was a good game. I watched it, and I usually when I'm at home at night, the Royals are on in the background almost all the time, and so that was a good win. So, is it too soon? Great question. Here's what I would say: the numbers of infection are really down. Right, especially of acute infections. And the bellwether of that is no longer the community rate, because it's really hard to know because testing is down so much and what the real community rate is. But the hospitalizations are a really important bellwether, and hospitalizations are really down. And so I think that's a really good sign. So is it too soon to be going to the K? Here's what I would say. If you've been vaccinated, nope, not too soon. I think the data outside is overwhelmingly strong. If you haven't been vaccinated, even though it doesn't feel right, I still think you should be wearing a mask to protect other people who haven't been vaccinated. Now, knowing that not everybody does that, here's my last thing I would say. If you haven't been vaccinated and you have a chronic health condition, be careful out there. I'd probably hesitate to go back right away. And what I would say is watch the data for another month. And if the data remains good, then I think by all means. But, you know, if I were you, I would do this in a measured format, because I don't think it's so much a global question as it is a personal question. And the personal question is, how healthy are you? How willing are you to take risk? And how willing are you to give that risk to somebody else? But if you've been vaccinated, I definitely think it's safe. And my answer is, as soon as I can get there after May 31st, when I'm in town and able to go, I'm going to the K. And I feel very confident about that because I've been vaccinated.
Yeah, and I think since the beginning of this pandemic, when people were wondering if they could get together with just family members, people they love and associate with normally, we've always said it's individual risk versus reward. I think since the CDC, the new guidance came out last week, we've pivoted even more towards that stance, understanding that you may be vaccinated, fully protected, but just understand that if you go into those public situations, the rest of the public or the full amount of the public may not be vaccinated. So you have to really identify those risks, understand what those risks are, and the benefit to those things. And when in doubt, you know, continue to wear your mask and distance.
Yeah, so I think it's a qualified, yeah, it's okay to go to the K. And the qualification is you better think long and hard on a personal level. And if you can wait a couple more weeks after that, and I'm not telling you have to, but I'm just saying on a personal level, if you're not sure about your own health or the people you're around and you're worried about bringing COVID-19 home, then you know, if you give it 2 to 4 weeks, you're going to know how successful and how safe it really is, because we'll be back in that situation, and then we'll know.
And you know, for me, you know, a personal issue is if I go out into these places and I do get the infection, I will more likely than be fine. But I still may have symptoms such as maybe a sore throat or a little bit of a cough for 2 or 3 days. But that doesn't negate the fact that I probably have to go get tested, and then I'm probably going to miss 10 days of work. So that's very important for me. I don't want to miss work. So I'm still going to be fairly cautious right now in going out and doing
So
things.
would you go after May 31st?
You know, an outdoor situation, I would feel definitely more comfortable.
Yeah.
It's more of the indoor situations where I have a little bit more.
That's where I am too. I'm not ready to go back indoors into crowds. I'm going to sit back and watch that data a little bit. I'm also 61 years old, which puts me in a higher risk category. But just, well, yeah, it does. I can't deny it. Unfortunately, I'm 61 years old, so it does put me in a higher risk category. And so as a result, I want to be careful with that. And I just, you know, I want to know that it's okay. I am a lot more comfortable with the outside data. I'm with you.
Yeah.
You know, Cody, we always give you answers. Sometimes they're not really snippets. They're kind of long-winded.
He's gone.
Nothing is simple
No,
in a pandemic.
that's okay. Sorry, I had to unmute myself.
He fell asleep.
Fell asleep.
He fell asleep. That's right.
No, really answer it. No, I'm just kidding. So Dr. Locke talked about being home for 10 days, and I had a question about travel. The European Union is starting to allow vaccinated travelers around without quarantine. And I'm curious, as we get closer to the end of school in the summer, if you had any advice for people who might be planning a trip.
Mm-hmm.
Yeah, be vaccinated before you go, and once you've been going, I don't really think there's a lot of difference flying across the ocean than there is flying across the country, and so that just isn't really an important difference. I think the only other thing I'd tell you to do is really watch the information coming out of the CDC especially, and saying if there's any variants you need to be concerned about or any worry about that variant and how well the vaccinations work. If you've not been vaccinated, I don't think you got to go. I think you're a risk to everybody in another country, and you're a risk to what you can bring back. That's my personal thought around that. But I think vaccinated travelers are a whole lot safer.
Yeah, I think understand your destination. What is the vaccine coverage there? Because we know not all the countries are as fortunate as we are here in the United States, so their vaccine coverage is much less now. We know that they may have other prevalent viruses or variants spreading, such as that variant from India and the South African variant. And understand that, you know, if you're going to a beach, you're going to be outdoors. Very, very low risk. But if you're going to be doing other things like visiting museums and stuff where you're stuck indoors, and although there still may be good ventilation, that's still going to be a little bit more riskier. So I would, in those cases, still wear my mask and try to distance as much as
Aren't
possible.
some countries, too, requiring you to quarantine? Like I know Canada does. You have to quarantine.
Yeah, they
for
are. The
14
question is
days.
that they're beginning to loosen those restrictions. If you're coming from what's considered a safe area, or if you're a vaccinated traveler, to Cody's point, that was reported the last couple of days, European Union is going to loosen those restrictions, and so you'll probably be able to go to England. You'll probably be able to get into France and Spain and Germany and others. And so I think I don't know where Canada is on that process, but I do think it's going to open up, and I suspect Canada will open up. Canada's behind us on vaccination. They just didn't have as many vaccines, so I think they've been a little bit more reluctant until they have more people vaccinated. The U.S. and England have done a pretty good job on vaccinations. Again, our problem right now, it isn't the number of vaccines available, it's the number of arms available. And we just don't have enough people volunteering to get that vaccine. Other questions out there? All right. Welcome, Dr. Lechtenberg. So we're glad to have you on the program. And Matt Jones, always a pleasure. Before we get into this question about stroke, and as a neurologist, I wanted to ask you if you are still seeing brain fog, headaches, and extreme fatigue in long haul patients. Give us a sense of what you think that's caused by. Where are we with it? What's going on out there?
My outpatient neurology colleagues are telling me they're still seeing a fair amount of patients with long hauler symptoms. Just like you mentioned, brain fog, headache, fatigue, malaise. I don't think there's a really well understood pathophysiology behind these long hauler symptoms. And, you know, that information is still evolving, but this outpatient clinic seeing long haulers is still quite busy.
Yeah, so that's a concern. And do you know if anybody's getting better with a vaccine from their long haul? Because we keep hearing
I've
about
heard
that story.
some reports of people having long hauler symptoms, then getting vaccine, and then the symptoms getting better.
Yeah. How many issues with cerebral vascular or stroke have you seen with COVID-19? Is that something you all have been taking care of patients with?
We certainly have. Initially, with the pandemic, we didn't see a lot because our cases were low, but as you know, the pandemic went on and the cases surged. At the peak of the surge, 1 in every 5 stroke activations or code stroke ultimately was diagnosed with COVID.
Wow. Let's say that again. 1 in 5 patients who had stroke symptoms had it, and they were because of COVID.
And that was our preliminary KU data, yes. And that was during the peak of the pandemic, yes.
Wow, that's a little. I didn't know it was that high. That's just, because for all us older folks, we figured it's just because we're getting old. But in this case, COVID-19.
COVID-19 played a major role in strokes during the peak time of the pandemic.
Yeah, that's a concern. I think it's dropped off a little bit now.
It's definitely dropped off.
Awesome. Okay, so what were some of the challenges that healthcare professionals had just handling all these cases and the things that are going on?
Sure. Whether there's a pandemic or not, acute ischemic stroke presents a challenge in that it's time dependent to acutely evaluate and treat patients to try and reverse these symptoms. So like every other healthcare provider in the world, we had to rapidly adjust every day to try and, deal with the pandemic, yet still keeping the importance of rapidly evaluating and treating strokes at the forefront.
So to all of our listening audience out there, we're going to talk here at the end of the program about some of those symptoms of strokes. We don't want you to miss out on those. Whether you've had COVID-19 or not, you need to have the stroke taken care of because this is a time-sensitive diagnosis, Dr. Lechtenberg. Talk to us a little bit about that.
Millions of brain cells are dying per minute when somebody has a stroke. It's estimated about 2 million brain cells dying per minute. There are certain treatments for stroke that you can try and reverse these stroke symptoms as they're happening, but as time goes on, people they're not eligible for these treatments anymore, so it's important people seek medical care immediately.
So I think some of the people I work with, Joyce Funk, I'm talking about you, are probably thinking that I have a lot of I may have had some loss of brain cells over time, and they'll look at me with a little bit of a wild eye at a time. how do I know? What do I do? I mean, how do I know how serious this is? When do I come to the emergency room to get care? What's my clue here?
Sure. Anytime there's sudden onset of acute neurological symptoms, somebody should seek medical care immediately, and they should call 911 and not take a private vehicle. And at the end of the program, we're going to go over specific stroke symptoms so that the general public is aware of those.
Yeah, I just think it's really important to stress that this is time sensitive. This is like a heart attack. If you start having chest pain, you got to come to the emergency
Right.
room. If you start having loss of your vision or whatever, you got to get here.
Sure. And some of these symptoms are obvious and some are a little more difficult to pick up on, like double vision or loss of balance, sudden onset of talking. Sometimes people might not think that that's a stroke, but indeed it is.
Yeah, okay. So those are really important points. And whether it's COVID-19 or it's just you've had these symptoms, you got to get here because
Right.
we have things we can do.
Exactly.
But if you wait too long, we're losing. How many brain cells do we have to lose altogether? What's the number there? Just give me
Some more than others.
what's in the denominator now?
Well, you're losing 2 million per minute, so there's many, many more than that.
Okay, well that's good because I think I may have to. I got to hope that denominator is a big
Right.
number some days. Okay, Dr. Jones, you care for a lot of stroke patients through your work here in internal medicine, especially taking care of inpatients. Yeah. You kind of have a better plan, and I know that's to avoid stroke altogether. Talk to us a little bit about what are some of the things you know to do and what you've heard others talk about doing.
Yeah, absolutely. First, thanks for having me. Talked to Dr. Lechtenberg about this at length, and it is very important to recognize early symptoms of stroke. But hopefully, what we can talk about today is how exactly we can prevent that. And first and foremost, I'd like to say that in addition to the stop smoking that you see on your screen, is that it's very important for our patients to really take an active role in their health care. I can't stress the importance of that enough. That includes actually, if you do not have a primary provider, establishing with a primary provider, working with them to understand your risk and how you can optimize your risk stratification. So the first one, we refer to the simple 7 as far as what's modifiable for our patients. So what can you do to actually prevent your risk of stroke? And the first and foremost important one is smoking cessation or stop smoking. Smoking has been associated with, it's the highest contributor to all-cause mortality, as well as morbidity, and as well as disability in the U.S. That includes very much so cardiovascular disease and stroke. So we know that smoking cessation is very important. And the good news here is if you do stop smoking, we can see very quickly benefits from smoking. Just a few months out, you can reduce your risk of primary stroke, even to the point to where several years later, if you maintain that smoking cessation, you can almost get to the level of a non-smoker as far as your risk for smoking. I do like to add with this as well, what can we do to stop smoking? What's available for us? There's a wide range of available measures to stop smoking, from cold turkey all the way to using medical therapies as well as combination counseling and therapies that I strongly recommend you discuss with your provider and what's most appropriate for you. And establishing that quit date is very important, and then how you're going to do it. I do often get asked, so what's the difference between smoking and what's the difference between, is there any difference in smokeless tobacco? And the recommendation there with smokeless tobacco is that it's still absorption of nicotine. It's just a different method of absorbing the nicotine and what you're getting from the tobacco products. And so there's still increased risk of cardiovascular disease and stroke. So it's really not an alternative method. The other aspect, and something that's very pertinent now, is e-cigarettes and vaping. A lot of patients and people in the community have turned to vaping for either a perceived safer alternative to smoking or a method to quit. And I would like to caution everyone that the verdict's still out on that. And keep in mind, this is still a method to get tobacco into your body, get nicotine into your body. And the recommendations out of AHA and ACC is that that is not a form that we should recommend for our patients as far as trying to quit smoking. And there's actually some interesting data that was published in March in 2020 that suggests that patients that actually have a combination of combustible smoking, which is traditional smoking of cigarettes, and e-cigarettes actually increase their risk when compared to just combustible cigarette smokers for stroke. So the combination of the two actually could further increase your risk. In addition, there are a multitude of other the simple seven. So one, eat healthy, diet. We want to look at dieting, exercise, and weight loss together, but also separately because they do have impact. So what we eat matters. So what should we eat? So what we've seen, what we know is that diets that are rich in fruits and vegetables, that are rich in legumes, so that's your chickpeas, lentils type foods, that are high in monosaturated fats and omega-3 fatty acids, but low in trans fats and polysaturated fats, can impact your risk of stroke in a positive way. Mediterranean diets have been studied a lot that are very high in these things. And next, with exercise, exercise is very key to stroke prevention, and I don't want it to be too daunting or anything for everyone, but get with your prime provider, find out what's best for you from an exercise regimen, and then in addition to weight loss. So it's very important with weight loss and understanding the impacts of weight loss and what it can have on your overall health and your risk for primary stroke. So weight loss has been tied in addition to the last three of the simple seven, and that's controlling hypertension or high blood pressure, as well as controlling blood sugars if you have diabetes, and cholesterol. So it's very key to communicate with your prime provider, follow them very closely, and work to optimize these different levels.
So what you're really trying to tell me is I have to eat right and behave. Is that kind of the story there, Dr. Jones? And, you know, can I just say whenever I say Dr. Jones, I feel like it's an Indiana Jones episode. Is anybody just mistaking you for Harrison Ford with those black glasses on?
I not necessarily Harrison Ford, but I did have a...
I think there was a band that used to play in Lawrence called Dr. Jones.
There was a band that played in Lawrence. Were you about to reference a band playing in Lawrence there, Dr. Jones?
I was not. No, I'm from Mississippi, born and raised, so I don't have any ties to the Dr. Jones band.
Okay.
Although
darn,
I bet they're great.
All right. Well, yeah, maybe it's something about the last name, or maybe not. Let's see if there's questions from the community out there, Jill.
There are. I'm going to start with Isaac. He has a question. He says, for our guest, have there been a lot of worse outcomes with stroke due to people maybe delaying their
Waiting
care?
too long. Boy, we've
Because they
talked a
were
lot
afraid
about that,
early
Dr.
on with
Lechtenberg.
COVID.
Yep, yep.
Yes, it's known that there are worse outcomes in stroke, whether it's a mild stroke or a more severe stroke, if you delay treatment, you don't seek medical care, and then you don't get that opportunity to potentially get this life-saving treatment to try and reverse the symptoms. So yes, there are worse outcomes. We've also seen worse outcomes with COVID-related strokes compared to stroke patients that don't have COVID.
Yeah, that's that 2 million cells a minute thing, right? Once again, don't delay.
Right.
Yeah, you may regret that. Yep, yep.
And Maggie is wondering if the COVID stroke patients, if they're suffering other long hauler symptoms, or do you just consider it their stroke?
That's a great question, and I think you just consider it their stroke. They had a stroke, potentially due in part to COVID. A lot of these, and this is important, it has to do with what Dr. Jones was saying, a lot of these patients who have stroke along with COVID have a pre-existing vascular risk factor, so they already have at least one risk factor.
Some of those things that Dr. Jones just mentioned.
Exactly.
So one question, what do you think is causing this long haul brain fog? Well, what's up with that?
Well, I think the jury's still out, but there's some different, thoughts on it, that maybe the blood-brain barrier was disrupted during the active COVID infection, because of cytokines, and that, the virus can go into the central nervous system because of that, and then result in these kind of longer symptoms.
So really, whatever you can do to lower your viral load, to not get the cytokines,
Right.
and to not get sick from COVID-19 will prevent long-haul symptoms.
It theoretically could prevent long-haul symptoms, and theoretically it could prevent, suffering from a stroke related to COVID.
And up to 30 to 40% of patients may have long-haul symptoms. So, Hawkeye, that means you want to get...
You want to get vaccinated.
I mean, it's just pretty clear. I don't understand the hesitancy.
There's still arguments out there, certainly concerns for safety. Again, I think that argument continues to diminish on a daily basis, especially when we understand you can have blood clots in 20% of people that have COVID-19. We've just heard you can have stroke in 20% of people who have COVID-19. That is a very high rate compared to any of the adverse events that we've seen that are reported from the vaccines.
So, a billion people have been vaccinated. They're not dying of strokes. No. Patients are dying of strokes from COVID-19. I just, gosh darn it, that just feels like the real story to me. Yeah. Any thoughts from your standpoint there, Dr. L?
Well, there are lots of people dying from stroke and having disability from stroke that don't have COVID-19. And so kind of back to what Dr. Jones was saying, controlling your risk factors and really preventing that stroke from ever happening is really the most important thing. And then we've already said if you do experience stroke symptoms, you come in as quickly as possible and we try and reverse those stroke symptoms. If you aren't eligible for that treatment or it's not as successful as we would like it to be, then you work on secondary prevention, which is very similar to the things Dr. Jones was going over, controlling your risk factors.
Yeah. All right.
Sherry has a question for Dr. Jones. Is occasionally smoking a cigar cause the same issues as cigarette smoking regarding strokes, especially if I don't inhale?
Okay, that's that Bill Clinton question. I don't inhale. You always, I'm going to be the lung doctor in the room for a minute. You always inhale when you smoke.
Exhale?
Yeah, you always inhale. Don't ever go into that rabbit hole. I didn't inhale. Yes, you did. The dynamics of air movement in your mouth, throat, and lung is that anytime you introduce stuff into your lung, you're going to get it into your air or into your mouth when you smoke, etc. You're going to end up getting some of that in your airway. You can still cause damage to your airway. Don't mislead yourself to think you don't inhale when you have a cigar in your mouth. Sorry, Matt, go ahead.
No, that's okay. I knew you weren't going to be able to resist that.
I couldn't. I just couldn't let it go. I'm sorry.
Being a lung
The
doctor.
pulmonologist came out.
Oh, my patient was, Dr. Stites, I've never inhaled. Yeah, well, neither did Bill Clinton and marijuana. Come on, really? Let's talk about that.
But to Dr. Stites' point, it's exactly right. You still absorb. And in addition, I'll address the portion of the question that I think was more so an occasional cigar once in a while. There has been association of volume of tobacco as far as your risk, but all in all, the recommendation is that none is better. None is best. So definitely cessation is the best.
And just to say, you may think lung cancer, lung effects, but cigars are especially associated with throat cancer and oral cancers. So you may think, I'm not inhaling, okay, but your throat doesn't like it either, and having cancer in your throat is like one of the worst things you can get. So don't do that. Let me say that again. Don't do that. And vaping is not safer, so don't do that. Okay, chill. I'm
Sherry
off my
has
pedestal.
a follow-up question for Dr. Lechtenberg. Do all hospitals have the life-saving treatment? I think she's referring to TPA.
That's a great question.
It is a great question.
Any hospital can deliver the first line of treatment, which is alteplase. It's a clot-busting medication, if they're prepared to urgently evaluate and treat stroke. Only comprehensive stroke centers are capable of doing the next level of treatment, which is thrombectomy. And that involves specialized physicians, a specialized team. It's similar to like a heart cath in the sense that there's a groin puncture and small devices are used to remove the clot from the brain. So not all hospitals can do that, only comprehensive stroke centers. And there's only 2 in Kansas.
And where are they?
There's one in Wichita, and then there's one here at KU.
But you might tell them about your care collaborative, or not that,
The
but
Care
the survey
Collaborative,
about
the Stroke
Sure.
Collaborative.
We've
Yeah.
got something called the Kansas Initiative for Stroke Survival, and that is a grassroots network throughout the state of Kansas where we've partnered with different facilities, no matter what size the hospital is, and provide education and support so that these hospitals are prepared to evaluate and treat stroke. And so we've seen a tremendous increase in Kansas in the amount of patients who have received the clot-busting medication and get thrombectomy, and in part due to our networking, throughout the state and the partnership of these hospitals.
So it's the Kansas Initiative Stroke Survival, or
Yes.
KISS.
Kansas
In this case,
Initiative
the
for
KISS.
Stroke Survival. That's
The kiss of life,
correct.
not the kiss of
Right.
death. There you go. Pretty good. And how many places are here in Kansas City that can do this kind of comprehensive stroke care?
Thrombectomy. Kansas has just the 2, and then there's 2 other comprehensive stroke centers here in the metro area.
Okay. So places you want to go if you're going to have a stroke, and that's going to be KU, Luke's, and
Research is a
I think,
comprehensive
right?
stroke
Yep,
center.
yep. Okay.
And like I said, any of the other hospitals, there's a lot of primary stroke centers in the metro area, and those hospitals, and even hospitals that are not primary stroke centers, are equipped to give the initial line of treatment, the clot buster medication.
But to be fair, not every hospital can do that. Because some small rural hospitals may struggle to do some
If
of
they
that.
cannot do it, then we usually will help them and help them feel more confident. Some hospitals we find don't carry the medication, and we help them get the medication, encourage them to get the medication, and provide them education. And so we would want all hospitals to be prepared to do that.
Amanda has a question for Dr. Jones.
Dr. Jones.
Okay.
I love saying that. It's just so good.
If someone was interested in starting a Mediterranean diet, where would you recommend they start? A dietitian, books, nutritionist, but she also says there's so many fad diets out there, it's hard to know what's healthy and what's not. What do you recommend?
That's a great question. Yeah, and I caution people whenever we go to the internet for our source of truth, because as you know, there's a lot of information, a lot of misinformation out there. In general, whenever if you're of an academic mind and you can read through some medical journals, there's good medical journals out there. Anything through PubMed, NIH is helpful. I will go back to consultation with a dietitian is always a good recommendation. Your primary care physician that you follow within your community might even have one in mind, or might already know some of this and have some of these local resources as well as some that they approve of. So I would strongly recommend having that conversation with them. In general, Google search isn't harmful. I just always use caution to say, be careful of what you read and if things are overpromised, because you're exactly right. There are a lot of fad diets out there, and it can't be said enough that really a lifestyle change is really what occurs. And make no mistake that that's the most successful diet is that is incorporated within a lifestyle change.
Dr. Stites, Kitty wants to know, can people who vape experience stroke
Yes.
the same as cigarette and cigar smokers?
Yeah, I mean, so this idea that vaping is safer, vaping has a different set of concerns, but it's not safer. It's not really better. There was a lot of, it's going to be better. Oh, no, actually, it's not. It's still bad. And the way I try to compare this is, if you saw a whole cloud of smoke out there and you just wanted to walk into it, how do you think that would go? But that's what you do with your lungs when you vape or when you smoke a cigarette. But vaping is still bad. And the answer is, inhaling foreign substances that are not air into your lungs is bad. And it's funny, we try to get around that by doing these other things, but it's bad. And the reason that vaping companies want to spend all this money to try and make you feel good about it is because they know it's bad too. And the reality is, inhaling lots of bad stuff into your lungs is bad. And I think that's just the simple truth. And people try to wrap it up with a bunch of other lies, but the reality is it's bad. Dr. Jones, anything you want to add to bad?
It's really bad. How about that? Yeah,
Yes.
I completely agree. It's shown time and time again that when we inhale things into our lungs, or when we put foreign materials that can damage our mouth into our mouth, you really are faced with a lot of the similar same outcomes.
Yeah, and my advice also, just as somebody who does have to follow some specialized diets for some different reasons, here's the reality. If it's fried and it's salty and it tastes really good, it's probably not good for you. So what you have to do is figure out how things can taste good without have it being fried and salty. And if you can do that, you can almost always eat a healthy diet.
If you remember before the pandemic, a year or two before that, there were a bunch of young people who were coming in with intense lung injury and having to go on the ventilator because of those foreign substances in the vape solution itself, whether it was the oils or some of the other chemicals and components. So, that really didn't happen with cigarette smoke, but when you have all these young people who are continually doing it and having them come in and be on the ventilator and having a difficult time getting off or not getting off the ventilator, that should signal to you that it's bad or worse.
So just to say, I think that at some point maybe we should have Dr. Solite come back down, because his whole research world is in vaping. And since this is such a hot topic going on, and I think as we trend, COVID's better, we got to keep taking on these broader things. Well, we're going to be taking on that question. So, okay. Other questions out there?
Dr. Lechtenberg, is LMH part of the network?
As the Kansas Initiative for Stroke Survival? Yes.
Okay. Nikki wants to know, is medical marijuana a risk factor for any of the medical conditions you're talking about today?
Medical marijuana. Okay, I would just go around the horn. What do you guys think? Medical marijuana and stroke?
There is some risk with marijuana use and stroke.
If it's inhaled or if it's oral?
That is a great question, and I don't think there's a lot of data on the oral.
Okay. Dr. Jones?
Same. Increased risk. And again, it goes back to when you're smoking, to your point earlier, Dr. Stites, of it's a foreign substance that you're inhaling into your lungs.
There you go. And I would just add to that there are some indications, I think, where medical marijuana can be very successful with anorexia and weight loss and some symptoms like that. And in some of my patients who have advanced disease have trouble maintaining caloric input with cystic fibrosis, we said, that's something to consider. But I think that going around inhaling it on a recreational purpose, yeah, I know a lot of people do that, or they vape it, and I'm just here to say, guys, really? You're still inhaling stuff that's a pollution problem, right? It's still like, let me go into this smoky room or into this city with all sorts of pollution around it, go back to Pittsburgh in the 1930s, 40s, 50s, or Cleveland, and think about how bad the air was and how many people ended up with lung disease. Just be careful here. Don't say you weren't warned, because we're warning you. Bad idea.
Okay, Jean and Yuri are going to get the last two questions right after I ask you what Melissa wants to know, which is...
That's 3 questions. You
It
really did
is.
3 questions.
Didn't you like how I squeezed that in?
Yeah, that was really good.
Is an anti-inflammatory diet similar or the same as the Mediterranean diet?
Oh, I am not the right dietitian here. I don't know. Dr. Jones?
Yeah, that label of anti-inflammatory diet, I would agree. I don't know if I'm the right dietitian. I think I've heard those terms used interchangeably, but I would just use caution and look at what the actual substances are within that diet. What are they talking about? Is it the fruits and vegetables? Is it the monosaturated fats, omega-3 fatty acids, fiber, and the legumes that we talked about?
I think we need to bring, okay, now I've got our second big idea. We need to bring some dietitians down to our program.
Yeah.
And let's talk what is a healthy diet and not just the fad diet. Okay.
Well, I will tell you, it seems like a long ways off, but the first week in July, after we come back from the 4th of July,
Yes.
we are going to be talking about COVID-19, and it's not the disease, but the 19 average pounds that everybody gained during the pandemic.
There you go.
And we're going to dedicate the week on how to
Eat healthy.
eat healthy, get rid of that 19 pounds,
Okay.
and move on. So, yeah, we got it in the lineup. It's coming up. All right, Jean's question from yesterday. Can you have long hauler symptoms that result from breakthrough infections in fully vaccinated people?
Yeah, I don't think, Hawk, what do you think? I'm not sure if we know that answer.
What we do know is the vaccines are going to reduce your full spectrum of disease. We know that even people with mild disease or sometimes no symptoms will have long haul symptoms as well. I think what we would expect, though, is overall your risk of getting those long haul symptoms and that long duration of those symptoms is going to be reduced. That's a good question. That is one of the questions that is being investigated right now, along with many others. So again, the data is still not complete. The question is being asked, the research is being done, we just don't have a good answer. But we would hope and expect that, yes, your chance of getting any long haul symptoms is going to be reduced.
Well, so first of all, your chances of getting COVID are markedly reduced.
Yep.
So that's going to reduce the long haul.
Yeah.
If you do get it, your viral load goes down dramatically when you do have it. And so the likelihood that you're going to have symptoms related to a high viral load, including long haul, is probably low. And so that's what I'm going to speculate, but we don't have the proof of that yet. But people are actively looking at that question. So we'll know more. Again, our airplane has so many more parts today. We can fly at a much higher altitude. And if you're vaccinated, your airplane is like a jet. But if you're not, then you're still in a single prop, and with lots of parts missing. But we'll know more as that airplane will continue to fly.
And
Okay.
Yuri has the last question. She's really concerned about what to do in church with singing and being close together and children in the nursery when there is no masking and no social distancing.
Yeah, that is a great question, Hawkeye. So our church is still distancing. We're still wearing masks when we're back, and you can hum. Maybe I mouth some of the words of the hymns with the mask on, but I don't sing it. And I try to hum it as best as possible. I'm usually off key. So everybody else thinks my having a mask on is actually a win. But I think that it's a fair question, and I'm not sure we know the answer to it, because really it's a question about inside dynamics, whether you're at a church or a restaurant or anywhere. And here's what we know. We know you're a whole lot safer if you've been vaccinated. If you haven't been vaccinated, you're not safer. And so that's the dilemma, and that's why the CDC said you can take your mask off and you can go indoors, you can do all these things if you're vaccinated. It doesn't say you can do that if you're not. In fact, they tell you if you haven't been vaccinated, you shouldn't do them, and if you have any doubt, you should wear a mask. So, it's a totally different story because vaccines work on it.
Yeah. Again, I think it goes back to individual risk and benefit. We know that Archbishop has or will be making Sunday obligation again in the Catholic diocese here in Kansas City. And then from that you have every church, and I would suspect this is pretty common around the metro area, every church is going to have their own protocols. Some will have no masking, some will have seating just as it was, some will have continued distance seating or maybe a combination. But even there may be still car masses where the church is able to broadcast over a low radio frequency so you can hear it and actually be there at the church doing that. So there are various things. I think really understand what is going on in that church or that place of worship you want to go to. And then if it doesn't meet what you need and meet your risk level, then certainly seek out other places to go and do that, because there's such a diverse components to all of that in any one particular institution or church.
All right, so tomorrow we have Dr. Anand Rajpara.
Mm-hmm.
He is our dermatology division director, and we're going to talk, remember, we're going to be talking about COVID effects on dermatologic conditions. You remember we talked a little bit about COVID toes earlier in the year, and hair loss, skin rashes, and undiagnosed skin cancers, and lots of other conditions, some of which can be related to COVID-19, and some of which are not. We'll be having that conversation here tomorrow. Hey, since Friday, we have given more than 90 vaccines to children here at the health system, in the vaccine clinic and in pediatricians' offices. But the vaccine is also widely available across Kansas. Don't hesitate. This is 14-year-old Cassidy Garmarker. She did not hesitate, and you may remember that name. She got her shot at the Walgreens near her hometown of Parsons, Kansas on Saturday. If her last name sounds familiar, it's because you probably know her dad. Anil has been on this update several times after getting COVID-19 in April of 2020. He remains a long hauler.
Yeah.
He says for his family, the decision to get the vaccine was easy. And even for 14-year-old Cassie, who says she got it because her dad fought COVID and won. But you don't want to have to fight and win. You just want to get the vaccine, folks. She was a little afraid of the needle stick, but admitted it didn't really hurt. Cassidy says her arm was a bit sore the next day, but that's it. And she felt fine enough to go to Disney World, which is where she is right now. She wanted to get back to having normal fun, to feel safe while having that fun, and says that was worth a shot. Good stuff. Hey, also, I want to see more videos or photos of people like Cassidy. Upload those videos or photos of your preteens and teenagers getting the shot. You saw Hawkeye's children getting the shot the other day. You can upload those using Facebook Messenger here at the Kansas Health System, or send to us at medicalnewsnetwork@kumc.edu. Final thoughts today. I'm going to start with Matt Jones. By the way, I just want to be clear, Matt Jones, you still have a head of hair, so you don't have to see the dermatologist about that. But you've had gray hair since you were like as far back as I can remember, because like you were a resident and I was a chair of medicine back then. I did not cause that gray hair. You've just had that. I think it's like a gene thing for you.
Yeah, if that's what helps you sleep at night, then that's fine, I think. But
Probably was that ICU rotation.
It may have been the ICU. I think it could have been the ICU rotation.
yeah. So as you can tell, Dr. Stites and I go way back.
Yes, we do.
in residency training. But yeah, final thoughts for me. Again, just take an active role in your health care. Establish with the primary provider if you haven't already. Address those simple 7. And you know what? Hey, I'll be so bold to add 8th as it relates to our COVID and stroke risk, and say get vaccinated as well.
Yeah, boy, that's great advice. And I'll tell you somebody else you better listen to, and that's Dr. Colleen Lechtenberg. She and I have worked together for a number of years now. She's the director of our stroke program and has just done an amazing job building that at just a superb place. I mean, if you're going to have a stroke, you ought to be here. And so I know you're going to have some final thoughts, and I've learned over the years I got to listen to everything you tell me.
Sure. Final thoughts just are, if you are having stroke symptoms, seek medical care immediately so that you can have the opportunity to have, life-saving reversal treatment. And I will also say get vaccinated.
All right.
Yeah.
Okay.
Yeah. Again, get vaccinated, protect yourself against blood clots in your lungs and other places in your brain, protect yourself against stroke, because we know that your risk is higher when you get COVID-19 of getting those types of complications, much higher than even than ever getting the vaccine. So please get the vaccine, protect yourself.
So before we close with our video here, just a few final thoughts. A, get vaccinated. B, get vaccinated. And C, get vaccinated. And also remember that even just some really cool shows like Star Trek can reverse strokes and things like that anytime. V for vaccination, live long and prosper. You still don't quite have that degree of therapy. We can't reverse a stroke. We can prevent damage from a stroke, but only if you're here. That means you've got to learn and understand the symptoms of a stroke. Stay tuned. Watch this video for us. We'll see you tomorrow.
Stroke can be a very difficult thing to sometimes know the symptoms for because the brain is very complicated. So we use mnemonics to help remember. We use BFAST. Every one of those letters stands for something. The B stands for balance. So when you're looking at this person, have you noticed that they're having a difficult time with balance? Are they walking differently than they normally do? Are they saying they're dizzy? Are they not sitting upright? Those are all signs of stroke. The E stands for eyes. This person may be experiencing a sudden change in vision. Usually it affects just one side of the body, including your eyes. The next one is F for face, which kind of just means facial droop. Is this patient having a droop on one side versus the other? A is for arms. The patient may notice that one of their arms becomes weak or numb all of a sudden. Sometimes they don't even realize it. I hear patients say, I just kept dropping my pen. I couldn't hold on to it with my right hand, just kept falling. The last symptom of all of those is S, and this is speech. This patient may start slurring their speech, or they may be speaking in garbled words, and you may have no idea what they're saying. And this could happen all of a sudden. We include in BFAST T for time. These patients are losing 2 million brain cells per minute, so calling 911 is key. The ambulances don't just drive fast, they call ahead. They call us, and we have a special team called the Acute Stroke Response Team. They are ready and waiting by the time the patient gets here. The CT scanner is reserved just for them, and we shuttle them in right away. So these patients receive treatment much faster.